Well, good morning, everyone. Really appreciate everybody coming out this morning. This is really a great event, the Fall Pennsylvania HIE meeting. First of all, I want to thank Edith Dees, who's sitting in the front here. Edith is the CIO of Holy Spirit Hospital, and this is the second year in a row that she's agreed to host this event. So thank you, Edith, for your hospitality. This is a wonderful location. So you can, yes, wildly applaud, as Kelly said. Another thing, I really want to acknowledge Kelly Lewis and TechQuest. Kelly is the leader of TechQuest, formerly the Technology Council, for having the vision to look at healthcare technology and to drive enhancements in healthcare technology, healthcare information technology amongst providers so that we can improve patient safety and improve health outcomes. And long term, that will have a return on health status for people in this community. It'll have a return in terms of dollars. We really need to share information. Providers need to share information so that we can improve care. So my hat's off to Kelly Lewis and the vision that he had, and I want to give him an awful lot of credit for pulling this together. So, Kelly, thank you. I want to acknowledge a few other people who've really done a lot of heavy lifting, and we have a really nice announcement that I'm going to make very quickly here. But first of all, Jim Talali, who is the CIO of Select Medical. Jim, where are you sitting? Here, there is Jim back there. Jim has been very instrumental in working on this, on all the projects around healthcare information technology for the HIE, and really appreciate his time, his talent, his insight around technology as well. So Jim, thank you. He is the vice chair here, and he could be up here as easy as I, and frankly has done a lot of the heavy lifting, not myself. I don't have the technology background, frankly, but am equally passionate about this subject. Also, Kent Whiting, the CIO of Capital Blue Cross. Kent is right here. He's going to be up here in a minute, has done an outstanding job as well, and really with his time and his talent around these issues. Let me just introduce the other members of the committee. Edith Dees, of course, who I already introduced. Edith is the CIO of Holy Spirit Hospital. Doug Dyer, who's not here today, he's the CIO of PCI Insurance. Jerry Hare, who's a manager with Deloitte Consulting. Jerry's not here, but he's helped as well. Kelly Lieblein from Highmark Blue Shield. Kelly has been involved, and I know she's very interested in these issues. David Paterno, who's president of Sage Life Technologies, has helped quite a bit on these projects. Stephen Roth, CIO of Pinnacle Health System. Rod Savage. Rod is here. He's head of HR for Gannett Fleming, and they represent the payer side of things and what payers are demanding in terms of improved healthcare quality. And Rod has been really helpful in giving that point of view to this organization. Kevin Splain, who's the Chief Strategy Officer from Penn State Hershey, he couldn't be here today, and I did mention Kent. So that is the board, and we're very thrilled that we have this amount of leadership and this type of leadership to help us. We have a really exciting announcement. We had a big day yesterday for the Pennsylvania Health Insurance Exchange. Through the collective efforts of all the people I mentioned, I'm pleased to announce that we're going to engage the consulting firm of Strategies for Tomorrow. They are a nationally recognized firm, and they've worked a lot on HIE issues. They've been involved with the Dallas-Fort Worth Medical Society HIE efforts. That's the 4th largest metro area in the country. Working on those efforts, they've been engaged by the Michigan Health Information Network and the Delaware Health Information Network. And some of these areas are further ahead than our community in linking doctors and hospitals together with healthcare information. But we're very pleased that we're able to go to the next stage in the HIE, and that is to have Strategies for Tomorrow develop a needs and a desires assessment for this community and assess our readiness to start to link our providers of care together. So we're hoping that we can take that information and then use that to raise more money and start this initiative. So we're really excited about that. I also want to thank our sponsors who are here today. DBSI, one of the leading business continuity and data storage companies in Pennsylvania. Thank you for your sponsorship. Probity MT, the largest medical transcription company in PA. Thank you. Covisint, one of the leading HIE technology vendors, and of course my company, Highmark Blue Shield. Again, one other note of thanks before I have one last comment. That's Dina Malley is in the back of the room. Dina put all this together. So Dina, thank you for your hard work and effort. You know, Kelly mentioned briefly about raising funds for the the HIE Health Initiative. We feel this is so critical for this community, for providers to be able to share information so that we can improve quality and have long-term returns for health status and cost in this community. Companies have donated $2,500, $5,000, $12,000, even $25,000, and I want to thank Jim from Select Medical. Companies have already put money behind this, but we need more. On page 14 of your pamphlet, there's a description of how you can get involved, how you can donate, and I would ask that if you can, to please be involved with your time, your talent, and your money. So it's very, very important that we're able to move this ball forward. Now I have the pleasure of introducing Mr. Kent Whiting, the CIO of Capital Blue Cross, and Kent has been a leader in the e-radiology efforts. He's been on the Technology Council, TechQuest Board of Directors, and has offered an awful lot to this to the Pennsylvania HIE. So Kent, thank you.